This is Mariah with Cindy's anatomy class. Today I'm going to be showing you some different terms when you're talking about the body, anatomical position, and then different planes you can cut across the body. So the first thing I'm going to show you is anatomical position. So when you're referring to anatomical position, it's talking about the body is erect and standing up. You're facing forward. Your arms are going to be straight. Your palms are forward. Your fingers point down, your legs are straight, your feet are flat on the floor with your toes facing forward, and then your eyes are forward. So right now this is showing you anatomical position. The next thing I'm going to show you is the difference between anterior and posterior, or also it could be called ventral and dorsal. Anterior is going to be anything talking about toward the front of your body or the belly side of your body. So anything in this area, it would be anterior. Posterior or dorsal is going to be talking about to the back of your body, so anything behind me. So this would be saying, like, an example could be, my palms are facing anteriorly right now in anatomical position. So if I went this way, my palms would be facing posterior, because it would be towards the back side of my body. The next thing I'm going to show you is superior or cranial, and then inferior or caudal. Superior is going to talk about anything going towards the head, where inferior would be away from the head towards the lower part of the body. So you could say your head is going to be superior to your abdominopelvic. Shoulders are going to be inferior to your head, if that makes sense. The next thing I'm going to show you is medial and lateral. So medial is talking about this imaginary line that goes straight down the middle of your body. Medial, you're going to be saying towards the midline. So an example of that would be your heart, which sits in the middle, and then your lungs are on each side of that. Your heart would be medial to your lungs. Lateral is going to talk about anything away from the midline. So if you look at your hand standing in anatomical position, your thumb is going to be lateral to your pinky, because your pinky is going to be closer to the middle of your body. The next two things are going to be proximal and distal. So proximal is going to be talking about toward the point of attachment to the trunk. Where distal is going to be talking away from the attachment of the trunk. So one example could be your elbow is going to be proximal to your wrist, because your elbow is closer to the point of attachment to your trunk. Where distal, you could say your knee is going to be distal to your thigh, because your knee is further away from the point of attachment. What I'm going to show you is the different planes. When I have Josh helping me out, the first one I'm going to do is the sagittal plane, which is a vertical plane that divides the body into left and right sections. So it would go down the middle, it could go to the left or to the right, but it's just going to divide everything into left or right. The next one's going to be your transverse plane, which is the horizontal plane, which is going to divide you into upper and lower sections. It's also referred to as a cross section, and then the next one is going to be a frontal plane, which can be called a coronal plane. So I'm going to turn him to the side, which is going to go down like so and divide you into anterior and posterior planes, so front and back.